The first question is mental illness associated with punishment? And the answer to that is no. Because all tribulations that come to a believer are not punishments, they are tests. And the word bala, ibtila, has two qualities. One is that it makes clear the good within a thing, and the other, it will make manifest what is good already in that thing. So these are the qualities. So it's not considered to be a punishment. Any test. So if somebody loses his sight, for example, you don't say, oh, God's punishing them. It's not what we believe. If not, why do some scholars say it is? Because they don't understand, and there's no evidence to contradict what I've said. I've heard them talk about the idea of earthly punishment given in this world rather than the hereafter. And that's true as well, but it's not related to mental health. Sometimes if somebody's done something wrong, Allah, it's understood that Allah might cleanse them, which is what if you look to the hadith that I mentioned, كَفْرُ اللَّهِ مِنْ خَطَايَاهُ, Allah will cover up or will the mistakes that they've done. And it might be that it's an act of purification, so to speak, but it's not a purification meaning a punishment. So there are elements of those two things which have been misunderstood and explained in a different way, and I think the word punishment, I think, is problematic, and unfortunately that's one of the things that does cause, I believe, causes mental health problems, because where we are focusing from childhood, you will be punished, you will be punished, you will be punished. There is a burning hellfire. And children are brought up with that from a very early age. I don't personally think it's healthy, and it's not what the Prophet ﷺ said you should do. He says, Bashiru wa la tunaffiru. Give people good news and don't chase them away. This is the Prophet ﷺ himself said that. Bashiru wa la tunaffiru. Give them good news, positive thoughts, do not chase them away. The second question, the idea of mind, body, soul, which other religions describe, like Buddhism, does this relate to Islam, and if so, how practically? First of all, the believers, the Prophet ﷺ says, Al-hikmah dalat al-mu'mineen, that wisdom is the lost property of the believer. And here, what's meant, and in another narration he says, Itlub al-ilmu law bisin, seek knowledge even if it be in China. What's meant is that knowledge doesn't have to be limited, or your understanding of knowledge does not have to be limited to what the Prophet ﷺ said or what's found in the Quran. There is wisdom elsewhere, and that's not that. So where you find wisdom in other faiths, in other cultures, especially when it's in matters like this, it's the dalat al-mu'mineen, as he says, it's the lost property of the believer. How does it work practically? I'll give you some examples. That the concept of breathing within Islam, within Buddhism, is fundamental to for example, yoga is all built around breathing. However, if you look at one of the great scholars of Islam, Mu'in al-Chisti, and therefore the Chisti tariqah, which interestingly several of our imams in Glasgow follow, it's built around breathing. It's built around understanding how how one controls one's breath, how one uses the breath to focus. And you might have seen people in their dhikr going into a state where they go, La ilaha illallah, La ilaha illallah, and they think, oh, that's this kind of crazy behavior. It's actually focusing on one's breathing and on one's heart. So where you see, another example of what one of the teachers is where they actually use the name of Allah to focus on the breathing. So they would, Allah. So they use their breathing to understand and contemplate the one that created the breath. And you'll find that technique is also used in yoga. It doesn't mean that so on a practical level, all of these can help. And as Saiki pointed out, that there are commonalities to all human beings and dealing with things like that.
So you're just saying that you understand this, yeah, what the cycle, for example, but you're struggling to implement some of the cognitive work. Just implemented some of the practical things. And I guess this is why therapy is really helpful, because you're not expected to do it on your own. You do it alongside somebody, and it's a very collaborative process. And it's not about getting it right or wrong. It's you're practicing something, you're reviewing it, you're coming back to, okay, might need tweaking. So again, you know, what I've given you today is very kind of black and white information, but when you're in that therapy session with the therapist, it's tailored around your needs. And if it was easy, we wouldn't get stuck. So, you know, I'd really encourage anybody who might have a similar question is just to try it out. Give it a go and try it out and see how you get on with it. Does that answer your question?
I don't think there's any easy answers, isn't there? It's just
It's a skill, isn't it? You know, if you're used to writing with your right hand and I say now write with your left hand, it's going to be pretty difficult, isn't it? You're going to have to practice, and you may never write as well with your left hand as you do with your right hand. And CBT is very much like that. If we're used to thinking in a certain way or behaving in a certain, what we're trying to do is just trying to perhaps do something slightly different, something which isn't natural or normal to us. So it's not going to be easy, but just like with any other skill, the more we practice, you know, we might have to come back and look at how we're practicing, tweak it up a bit. And that's the role of the therapist, really, to support you through that process of change.
Talib al-Makki was, he described the spiritual path as having 3 phases. There's knowledge, ilm, which leads to amal, action. And knowledge on its own is no use unless it leads to action. And amal, action or doing something, leads to what we call a hal, a state. So you know that patience is good. But knowing that doesn't make any difference until you're actually put in a test. And then when you tested, you become patient and it becomes a state, and then it confirms the knowledge. So this is something that we all have to go through. And a good example is what you were talking about, diaries. It's something that I use when I'm coping, especially when I'm facing a difficult situation. And when Sarah was very ill, that was one of the things that I was doing. I was continually writing a diary, and almost every day I would write in the diary, I am content with God's decree. I'm content with Allah's plan. Every day that would have fit, somehow it would have fitted in there. But then one day Sarah was in the hospital, and remember she'd just come out of intensive care. She'd been in there for 4 months, and she turned around and she said, I've never been happier in my life. And it just knocked me back, because I'd never used the word happy. I'd said content. But interestingly, a couple of things happened a few weeks later, and then it just struck me what she meant. Yeah, I'm actually happy now. What I just said in the talk is I've never been happier. But where did I learn that? Was actually from Sarah. I knew all of that. I'm supposed to be a sheikh and all of that stuff. But until you're actually tested, which is why the word testing is so important, you don't really practice it. And that's one of the reasons why we put into these situations. And then it becomes a state. And that's why if I lose my passport, I don't actually, I was trying to think, well, it's not a big deal losing your passport, because it doesn't, a lot of things don't fret, I don't worry anymore, because it becomes a state, and then you do become patient. And Sarah said, what would she do? She'd start swearing. That's the old Sarah. And she used to get very angry, but she doesn't, because with practice it comes. So knowledge leads to action, which leads to a state, and it will come. It will come.
So that the question is, OCD, is it to do with the shaitan and nafs, or
is it
coping mechanism? Okay. We should have had Paul here. Our new president of the BABCP is Mr. OCD, isn't he? I guess, again, you're coming back to that spiritual perspective. So when a lot of Muslims that I know somebody is having problems at the minute, and it's around wudu and praying and repetition and washing, to the extent that they can't pray anymore. And I guess it's fueled by the anxiety of not having their prayers being accepted and validated, coming back to that concept, I guess, of being punished by God. Where does that come from? You know, the madrasas and the mosques, and you know, so it's kind of coming from there. So I guess in terms of the shaitan, I'll let Sheikh answer that. But in terms of psychological perspective, it's an anxiety disorder. Okay, so the fear there is being punished of not getting the wudu right or your prayer right. So you have to do certain rituals. Okay, which then, you know, sometimes they're mental rituals, sometimes they're behaviour. It's not all just washing hands, it could be counting, you know, lots of different sort of behaviours.
Like I said, I mean, I can tell you from personal experience, these are behaviours or cognitive behaviours. And it's not in my case, it's not a problem under normal circumstances, but it can be a problem. Because, for example, there was a point where I couldn't get to work because every time I got to the roundabout, I needed to go back to relock the door. But this became a problem, not because it's a behaviour of mine, it's because I was going through other issues that I didn't know I did know about them, but they just manifested themselves in a different way. And I can joke about how my ex-wife used to say, "You're so German," because I was so, and I was thinking, I never lose my passport. Why? Because I check my passport every 10 seconds. Oh, yeah, it's still there. 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 So I've never got to a point where I've gone for two or three minutes without checking my passport. So you're right in one sense that it's a coping mechanism. As for Shaitan, I wouldn't like to blame him for my behaviour on this occasion, because that's another option that the brothers, you know, will be very aware of. You know, we blame Shaitan for everything and hope that Imam can sort it. You know, you're kind of actually denying your own situation and your own role in this, and I think that's not a positive way to approach this. It's much more positive to look at it as this is a behaviour that can become problematic if it becomes excessive, as it did in my case occasionally, and you need to deal with that. And that looking at it and trying to deal with it, in whatever means it necessary, is what we need to aim for.
So the question is about the use of medication and what role it's got to play, and does it have a role? I think it's a really important question in terms of very much what we see within psychiatry is something called the biopsychosocial model, where we understand that there's biological factors that are important in causing mental illness and mental distress, and sometimes that's part of the solution. There can be psychological issues as well. So, for example, if your own experiences about your past, the way you see the world, the way you think about the future, that can have difficulties around that. There can also be social issues as well, in terms of looking at, you know, as the problems of debt, poverty, relationship issues. And so very much this biopsychosocial model we know is a very recognised issue, and I think very much what is recognised even within the Royal College of Psychiatry is something called the spiritual angle. So it's called the biopsychosocial and spiritual angle. So we know that there are spiritual aspects, and very much in terms of mental health issues where it can affect people in very different ways. Each one of these domains, people can sit on different aspects of this on the spectrum, and for some people the biological factors are more important, or psychological, social, but often it's a combination in the spiritual aspect as well. So my response would be, we know that in some cases medication isn't helpful, but in many situations it's a combination of these type of approaches is what's most useful for people as a holistic approach. Sometimes the things that Psych has talked about in terms of the psychological aspects, what we know is that when you're really depressed or anxious and you're struggling to get out of bed, your concentration's poor, it becomes really difficult to engage with these sort of things, and medication can get you to a level where you're well enough to engage with this sort of therapy. And we know people do a combination of psychological therapies as well as medication do better. And many people where there've been previous past adverse experiences growing up, we know that perhaps medication has a very limited role, and is more a psychological approach in terms of understanding issues around the way you've been treated in the past, maybe if bad things have happened in your upbringing, and that can certainly affect you in later life. And a medication or a pill is not going to take that away, but we know that, so it's the key thing about us, I guess, from a scholarly perspective, from a medical perspective, a therapist perspective, is unlocking the combination of these issues for that individual person and trying to help them in these domains. And the final thing I would say about medication is that medication can be seen in two ways. One is that it gets people better, so it treats the acute side of the illness, but also has a preventative role in many illnesses. So it's a prophylactic or a preventative thing. And so when people are on it lifelong or for many years, it's about preventing a relapse of their illness. And very much you could see it as any other sort of chronic health condition. If you've got problems with high blood pressure, you might be on medication for blood pressure for many years to help control it. Or if you have diabetes, you might be on insulin. And so very much thinking about medication, I wouldn't see it as a negative thing, that it's something that is, something that you have to defeat, or, a marker of your progress is you have to come off medication. If it's keeping you well and it's helping you and it has a preventative role, then, I think staying on it and keeping well is perhaps very important. So I think it's different in different people, but I think medication does have a role in the right type of people and the right sort of illnesses.